I want to bring into the conversation now the Executive Director at South Africa Responsible Gambling Foundation, Sibongile Simelane-Quntana. Sibongile, thank you so much for your time. Really do appreciate it. 61% of gamblers have reported that they gamble weekly, and the other 40% report that they gamble more often than weekly. In fact, 20% of gamblers in South Africa borrow money or sell their assets to fund their gambling habit. Sounds like a country in crisis. Yet the industry seems to be raking in profits, unimaginable profits. From the vantage point of your organization that deals with people that have addictions, that signal positive messaging to people to get them to turn their lives around and move away from gambling, what can be done immediately to at least get people to behave differently?
Good evening, Oliver, and thanks for the opportunity. Look, I think we need, first and foremost, we need to acknowledge that we've got a crisis as a country. And I think there's enough blame to go around in terms of what has happened and where it has gone wrong. The reality is that we've got people that are battling, to make the ends meet. And indeed, people are actually finding alternative gambling so that they can raise money, they can put food on the table. We do have a number of programs as the foundation which create awareness about problem gambling. We actually have public awareness programs that we do with provincial legislative authorities, that is the provincial gambling boards. And also we include on board some of the operators, because I think one key thing and one key understanding, Oliver, is that I think the operators, in as much as they actually get profits, they do care about what happens to the people that are putting money, for them on the table. Take, for instance, if somebody is addicted, addiction is a long time problem. That means that that person has thrown away their entire life. That means that this is a client that we need to keep in treatment for quite some time. It means that it's a client that has been lost because they are indebted, they can't get further credit, they can't feed their families. So yes, indeed, we've got a gambling problem, but that doesn't mean that the gambling operators are actually at a space where they say, look, let it go where it should go. One key major thing that we need to address as the country is the accessibility of gambling. We need to immediately pass regulations that minimize the accessibility. I am glad that the provincial legislative authorities have actually started to put together a policy document that they will present at the minister, where it deals with these issues that we're talking about today. It looks at issues of problem gambling, issues of responsible gambling, issues of how, as a country, we need to deal with interactive gambling. Now, you mentioned in your presentation that legislations take longer for us to actually do anything. We have short-term interventions such as the regulations as well as norms and standards that the country can pass. And those are what the minister can do. Now, we have an outcry, and I think I do understand that it's very difficult for the minister to actually promulgate any regulations or norms and standards without consulting the industry. He had the first National Gambling Policy Council meeting. From that, stakeholders such as the problem gambling, the CEOs of the various gambling boards were actually mandated to go and develop a policy document that as a country we will look at. And it touches on a number of issues that we are crying about as a country. How do we minimize gambling exposure? How do we create public awareness on how people need to gamble within their means, so that we don't find a country where gambling has actually running away from it, which is currently what it is. For instance, as an organization, we actually have our treatment statistics have risen to 64% from the previous financial year. In the year that ended in 2024, we actually treated 2,066 people. Come the end of 2025, we actually treated 4,664. That is a sharp increase in a country that is rated with high unemployment and unemployment rate and poverty.
Sibongile, perhaps this question And to Magashule Ghana's point, do you believe that online gambling operators like Betway and Hollywood Bets, which are members assigned to your organizations and make contributions towards, of course, responsible gambling in South Africa, do you think that they should be able to advertise and or be oxygenated in media?
I believe that there should be responsible gambling advertisement. I believe that currently advertisement is actually a problem in this country. I believe that our operators can self-regulate and understand that certain times, like in the social media, we've got kids that are on social media, they actually see those gambling advertisements. I believe that we can't be turning our radio station each and every time and be inundated by gambling advertisement. I really truly believe that, certain gambling operators can actually self-regulate. I understand that some of them, in actual fact, Oliver, have started that. They are pushing more and more messages of responsible gambling. But there are those operators that still have not gotten to understand the impact of advertising. When you promote a brand, you are literally
Oh, Sibongile, seems like we have lost connectivity there. Let's see if we can re-establish that connectivity with Sibongile Simelane-Quntana, who's the Executive Director for the South Africa Responsible Gambling Association. Sibongile, are you still with us?
Yes, I'm back.
Yes, maybe just to cadence the conversation with this question, Sibongile. Alcohol and cigarette manufacturers are seen to have placed a burden on the South African healthcare system. And a way to counter that is through instruments like excise taxes. We typically call those sin taxes. And the money collected from sin tax is thought to be able to help the healthcare system be able to deal with the burden that alcohol and cigarette tobacco consumption places on the healthcare system. Now, of course, there is a social impact that gambling and gambling addiction has in South Africa. Should we begin to consider excise-like instruments in getting on the gambling sector to make sure that there's enough money available to deal with people who need help, but more importantly, to deal with positive messaging around gambling and responsible gambling? I say that keeping in mind and knowing that responsible gambling initiatives like the one that you're responsible for collects monies from gambling operators for exactly that purpose. But of course, it's a very small contribution that they pay as members. That something more permanent, like an excise instrument, could be a lot more effective. What are your thoughts on that?
Look, I would support any initiative that will ensure that the public health burden that is placed by problem gambling is actually minimized. For instance, for our rehabilitation, we only admit people up to 21 days because we've got minimal financial resources. And to admit anyone, we actually have to pay between 30,000 to 50,000, depending on the institution that we've actually are taking the person towards. So I will support any initiative, and I think the National Treasury is better placed to actually assist us in this regards to say what is the best way over and above the taxes and levies that the gambling operators are actually contributing, but also to reflect to say that the 0.1% that they give to the South African Responsible Gambling Foundation, is it sufficient? And also one thing that I'm not sure if you're aware of, not all the operators are actually contributing towards the Responsible Gambling Foundation. Some operators, big players in the industry, they believe that they are not obliged to contribute. So we actually find ourselves having to literally beg and say that, look, you as an operator, you have an obligation. Harm is being created. And one way of acknowledging that harm is being created is to also acknowledge that the very same people cannot access help. They don't have money to go for treatment and counseling. And therefore, contributing towards responsible gambling, it's a means for us to be able to provide the treatment and counseling that they need. We have a national footprint of psychologists, clinical psychologists, and psychiatrists that actually assist the foundation in ensuring that we provide the treatment and counseling. But also, Oliver, I just want to talk about this. I think we need all the people on board, particularly the banks. We find some of our people that are receiving treatment actually informing us that their bank apps have, advertisement, or they've got access, this advertisement of gambling operators. I think we need assistance from the Bank Association of South Africa, that their members need to ensure that people opt in and out. People who doesn't want to see gambling-related apps on their banking app, they should be in the position to opt out. And the bank, as part of their education awareness, needs to inform users, how do you opt out so that you don't see them. Not everybody wants to see gambling each time they open their bank. And this is how people get hooked. This is how people actually find it very easy to gamble.
Yeah, Sibongile, we're going to have to leave it there. Thank you so much for your time and your insights. Really do appreciate it. Sibongile Simelane-Quntana is the Executive Director of the South Africa Responsible Gambling Foundation.